And for more, let's bring in Dr. Ronald St. He is the former Director General of the Public Health Agency of Canada's Centre for Emergency Preparedness and Response. He joins me from Ottawa today. Dr. St. Thank you so much for taking the time to speak with us. So Health Canada is pausing the distribution of the Johnson & Johnson vaccine because of possible quality control concerns there. Should it give Canadians confidence in the safety of our vaccines that this was flagged at this point, or does it raise concerns about the supply that we're receiving in this country?
I think the confidence should be placed in the safety checks, that there are systems in place to make sure that the products that are made available to the public in Canada are the safest possible products. And if there is any question of any kind of quality control issue, then you have to put a stop on and reevaluate the situation. Safety first.
Right. And so can we talk a little bit about this Johnson & Johnson vaccine, why it's important, how it should be used?
It's important because it's a one-dose vaccine, and it doesn't have the difficult conditions for storage that the Pfizer vaccine has, Moderna cold storage requirements. So the Johnson & Johnson vaccine makes it very easy. We're noticing that in the U.S. there are reports that about 8% of people are not coming back for their second shot for a variety of reasons, I'm sure. But that second shot makes it more difficult to get complete vaccination of the population. A single dose is preferable, but it has to be safe.
Right, and speaking of the first and second shots, with the vaccine supply in Canada increasing, set to ramp up to 2 million doses of Pfizer per week arriving in this country starting this month, May, should provinces be moving towards shortening the delay between the first and second doses?
It all depends on supply and the ability to distribute that supply. If you can handle more vaccine doses and just get them into the arms of people before the expiry date of that vaccine, then yes, we should get as many people vaccinated as we possibly can.
Okay, I did want to ask you about something the federal government says is going to be coming out shortly. Guidance on what Canadians can and cannot do safely after their first and second COVID-19 vaccine shots. What do you expect to see? We've already seen some guidance from the CDC in the United States.
Well, looking at the CDC guidance worries me a little bit because it gets rather complicated. You can wear a mask when you do this, but not do that. You can go here, but not there. You can be indoors, but not outdoors, or vice versa. I think it makes it more difficult for people to understand when to wear a mask or when to social distance and so forth, and when to stay home. So if we're not careful, we ease up the restrictions or we make a lot of conditions, then it makes it more difficult for people to follow those conditions. Personally, I think we have a package of measures: the mask, the social distancing, the stay at home, reduce your contacts, and so forth and so on. This package drives down the number of new cases of the virus per day. And I think we should follow that package until we get the virus down to some really low level where the public health units across the country can manage that level better than they can manage thousands of new cases per day.
There's a new study in the United States that kind of takes a closer look at that package of guidelines that you were talking about just there, that suggests how long you spend indoors with other people and whether people are wearing masks is a better indicator of your risk of contracting COVID-19 than how physically distanced you are from others. What did you take away from that study?
Yeah, this is a modeling approach to looking at airborne transmission of the virus to be distinguished from droplet transmission. But there are a lot of assumptions that go into a model. For example, in any given person, the amount of virus in your throat will be different. Some people have a lot of virus in their throat, and if they speak or laugh or cough or holler or whatever, sing, they put out a lot of virus. Others have smaller amounts of virus, so they don't put out as much. So there's one thing to consider. The next thing to consider is the droplets that come out. We don't see them when people sneeze or cough because they're quite small. But even in that group of droplets, there are bigger ones and there are smaller ones and there are ones that are very small. And any droplet can carry the virus. We have the social distancing because we thought and we know that the first droplets, the bigger droplets, will fall to the ground within about 2 meters. But now we also know that the virus can remain suspended in the air for a period of time. And that period of time depends on how much ventilation there is. and it depends on how close you get, and it depends on whether you happen to walk into a cloud of virus in the air or no virus in the air. So there's so many variables. That's why I don't think we should throw out social distancing as one of the measures that we should keep in place.
Definitely. Okay. So we definitely thank you for your insights and for sharing those with us today. From Ottawa, Dr. Ronald St. John, former Director General of the Public Health Agency of Canada's Centre for Emergency Preparedness and Response. Stay safe.
Thank you. You too.